Well, Ty, here we are. We've been wanting to do this for a while now, where we get a chance to connect with our audience and let them know a little bit about your company and what we're doing in the Charlotte, North Carolina community. And also get a chance to kind of talk about how you feel about certain issues in the medical industry, what's going on in the medical industry. Also, I'd like to talk a little bit about what you're doing with some of your patients and progress that we're having. So let's just kick this off. We just want to talk and be comfortable and relaxed here, a nice environment, so that people can understand what we're all about. So why don't we start with, tell me a little bit about Corrective Care Wellness and Ty Spencer. Who are you?
Well, first up, I have to say that I'm a mom of 5, and 3 of my children are adults. 2 of them are still very young, 7 and 5. And I've been involved with natural health care since the early 90s. It began largely because my younger son was very sick when he was young. And I did not see, after 4 years of back and forth to the doctor, several visits in the hospital where he actually had to stay over, extensive testing, and I just was not getting the results that I wanted for his care. I was very disappointed in the fact that after numerous years of several different antibiotics, he was still sick and actually getting sicker. He was told, well, I was told that he would probably have to have tubes put in his ears because of chronic ear infections, and then it graduated to bronchial infections, and the last hospital visit that we had was pneumonia, and he was a little boy, 4 years old. So as a mother, your level of frustration is mounting, not only because you're tired, you're physically tired from running back and forth to the hospital and the doctors, but you're also emotionally tired and mentally distraught because you feel as though you should be able to get better answers than this from an industry that is rather expensive to get care.
It's a big issue right now. It's a hot button, if you want, with the politicians. They're all trying to find things, scrambling for things that they can discuss and feel that they can improve. But do you feel that they're doing a good job? What's the status of the medical industry, in your opinion?
I feel that I can't speak for an industry that I don't get that close enough to understand the inner workings of it. I can only tell you that investigations are being conducted as we speak into practices in the medical industry. The expense that goes out in terms of cancer care, wherein people really don't seem to recognize that cancer is something that is a part of your body. It's tissue gone wild, basically, in your body, and it's something that can loosely be turned off and on like a light switch.
See, and that's something that no one ever hears that. No one knows that they have cancer cells already. It seems to be that when they find out they have cancer, oh, I got cancer. I got cancer.
As if it jumped on them like some beast out of a dark alleyway.
Right.
And that's not what happens with people. It is a lifestyle that leads to cancer, and you can turn that lifestyle around just as easily if you are focused and ready to do the work, because it is work. It's work to pick up your fork and put food in your mouth. You just have to change what's going in your mouth.
What's on that fork.
Exactly.
Yes, exactly. So what are you doing now? You're with, you started this company, Corrective Care Wellness. You made it a nonprofit organization. Tell me a little bit about why that decision to make a nonprofit, what benefit, what are you doing?
Well, one of the issues for me was here I was 18 years later doing muscular therapy, doing traditional Chinese medicine, which are my background. I'm not an MD medical doctor. I do not prescribe. I cannot, tell people this is what you should do when you go home. But working in the natural health field, we can make suggestions. This worked for this client, and maybe you want to try it. It gives people power. It gives them back their power to recognize that they can do something different other than run straight to your doctor for all the answers. And there are many medical doctors today that readily accept that natural health care is a good avenue. It's just simply that there is a larger industry, pharmaceuticals, and the medical industry. They collect quite a bit of funding from people being sick. There's a lot of money to be made in people being sick. So one of the reasons why we set up as a nonprofit was because more and more the economy is speaking to a necessity for a change. A necessity for a change not only in how people are paying for their medical care, but what their medical care is. It speaks to the necessity of recognizing that you cannot just rely on drugs. You cannot just rely on the established medical industry as it is. There's too much information out there now that points to an easier, more economical way of doing things that's actually successful. It's not just people deciding, well, I'm going to take my care into my own hands, and then they go home and they keel over and die. More people die in the hospital doing it their way versus going home and handling it in a more natural way.
Mm-hmm. Yeah, I have personal experiences with the hospital, particularly with my family, and I can personally relate to some of the issues that have come up. Some of the close calls, that's what's really disturbing, the close calls that we've had with the doctors, and my family's life in danger. So I know what you mean. But now, how is Corrective Care Wellness being another choice? What choice is Corrective Care Wellness as opposed to going to the doctors?
Well, for one thing, the time that I've spent over the years studying what vitamin and nutrient therapy can do for the body, people are so much in a deficit. We talk about the country's economic deficit, but people are so much in a deficit in their bodies 99% of the time that they just can't do anything different. They can't even make better choices because their minds are not working properly. When they do come to the understanding that, oh, well, I need some zinc, or I need some selenium, or I need some omegas, they don't know where to begin to understand, how much do I need? When do I take it? Where should I get it? So one of the things that we've done, again, as a nonprofit, is that we're providing education for people to empower them, to take better care of themselves, to be able to make wiser decisions that are cost effective. And we have found in just the last 4 months a source with longevity. Longevity was developed by Dr. Joel Wallach and his scientists, and we have found that that particular line of products has been extremely beneficial to the clientele that we work with. Many of them who do not have health insurance. And even under this new Obamacare plan, many people still may not have insurance, and then they'll be penalized for not having insurance. So better to be able to do something proactive for your health if you're going to be penalized for not having health coverage, because you'll need to work to pay whatever penalties there will be.
All the options are being taken away.
Exactly.
Well, what we want to do as far as corrective care wellness is concerned, we want to try and teach people one message. What is that one message that after today, after this little interview, people need to get the message?
Go to your doctor. Find out what's wrong. If there are things wrong, be proactive about your health. Don't wait for someone to tell you, take this prescription and then you'll have to take another prescription and you'll have to take 3 other prescriptions to combat the effects of the last 2 prescriptions that you received. Take your life into your hands and do something with it. Get on board with understanding how your body works and the mechanisms that are going to help it to heal. Because people don't recognize that your body can heal when it is provided what it needs.
Very good. Well, I am very thankful we were able to take a little bit of time doing this. We're going to be doing this a little more regularly. It's such a pleasure to work with you since I've met you, and I appreciate all the help that you've done for me and my family. And perhaps on another episode we'll go into that a little bit, about how you've helped people close to you and how you're helping people in the Charlotte community. Okay?
Thank you.
Thank you.